Ow.
There's a much better model, Sam, than single payer or Medicare for all. If you're looking for a transitional service that works better, look at the Singapore model for healthcare. It's a much, much more robust model. It works better across the income spectrum. It incorporates some market
price
corrective
caps,
forces
price
with
caps,
the safety net.
Price caps, caps, and
Singapore?
heavily regulated. Yeah.
No, well, Singapore. The thing is, everybody has a health savings account that
Price
continues
caps
through their life, and there's a mandatory amount of withholding.
Are you okay,
So
Nicholas,
first
as the
dollar-
chairman of the Libertarian Party, with price controls issued by the government?
I am not.
Well, wait a second. You're proposing Singapore's model.
No, what I said was, if you're looking for something better than what we have, a Singaporean model would be much better than Medicare for all, because you still have people who receive services paying something out of their own pocket, which makes them conscious of cost. That's what increases quality. I mean, if you want to look at the difference
wouldn't that be
between
the case right now?
government-controlled
Well, then
healthcare
wait a second. You just complained to me about copays.
I
With
didn't
the
complain
Affordable
to you
Care
about
Act.
copays. I complained to you about deductibles.
Well, but
that
paying
are
for that
$6,000
stuff
a year.
Well, but
before
isn't
you
that,
get any service?
But wouldn't that make it? Wouldn't that make it make you as a patient, as a consumer, more sensitive to creating better quality?
No. When you have a deductible that's that large, you actually create weird, perverse incentives to stack your health care into 1 year. So you have people putting off care that they should get that would cost them less because they want to, have their surgery and get Johnny's teeth fixed and do everything in the same year, so they might actually hit their damn deductible. The incentives get perverted. If you look at laser eye surgery, Sam, it's not covered by any
What is
health
it with you
insurance.
guys and laser
And
eye
the
surgery?
prices-
What's his
Because
face?
the prices went down and the quality went up. It's exactly the opposite of every other part of healthcare.
It was
the difference is
because
you pay out
of
of pocket.
rollout of technology. That also happens with stereos too. I mean that.
Yeah, but it happens with MRIs, but those prices go up. Their technology is getting better, but because it's an insurance model and because the government is involved in setting the prices through that same pricing model you talked about, where Medicaid sets prices.
Medicaid only sets prices
year.
now. Only sets prices now.
They set the
for
guidelines
Medicare,
for reimbursement
for Medicare, right?
With the AMA. So it's basically you have a cartel of doctors, you have a government agency.
What makes you think that we're not going to have a cartel of doctors with Singapore, the Singapore model?
For everything they regulate. Sorry, I didn't catch that last
What makes
bit.
you think we're not going to have a cartel of doctors with the Singapore model?
Because the reason that the cartel is less effective with a Singapore model is as long as the first dollar the consumer is paying is an out-of-pocket dollar, they're going to be looking at quality of service compared to price. They're going to be making the decisions that you make when you go to Costco about, do I buy the cheap stuff or the medium stuff or the expensive stuff? If it is paid
what are we
for by
wait,
someone
I'm just
else,
curious.
you
I'm just
don't
curious.
think that
What is
way.
it that we're buying at Costco? So I just want to actually get a real world sense of this. So I'm looking at the Cheerios at Costco versus should I get
versus some sort of organic, whole grain, whatever it is.
Okay.
Right? And then you make the choice of do you want cheaper calories or better calories?
Okay.
With your money.
Fair enough. Now, when I go into the doctor,
well, hold on
for 1 second.
Whatever the hell you want.
When I go into the doctor and they say, well, we can do this type of radical surgery, we can do the laparoscopy, or we can use radial surgery. Now, how do I make that assessment? I mean, I'm on top of the Cheerios.
You make any other assessment. I mean, if you look, let's go back to the eye surgery. There's radial keratotomy, there's LASIK, there's some new stuff with these little flaps that they can change out, where it's like a contact lens inside your eyeball, and you decide between you do the research and you decide what's best for you.
Okay, so I've got to learn about different surgeries, and not just LASIK. I mean, that's going to take me a while. But if I, God forbid, I get something that I don't have I have to crunch time on, like, what's the best way to treat this spreading cancer or something. I guess I got to read into that a little bit more to figure it out.
Well, you talk to your doctor about it. I mean, that is how medicine works.
Well, how do I know if my
general, right?
doctor
Your doctor talks
is
to
the organic or the other type of Cheerios or whatever it is?
Well, one of the ways that people have been using now with the advent of social networks and, better technology is they have services like Yelp for doctors, for medical providers, where you can say, this doctor sucks, this doctor's great, this doctor had good outcomes, this doctor had bad ones. The one that people would really help, but the doctors fight against, is actual published pricing for what procedures cost. There's a differential of hundreds of percentage points in the same geographic area for, say, an MRI. You don't know what the MRI provider charges, and they work real hard to make sure you can't comparison shop. That's how you get gouged.
Now, so on the Singapore model, if we were to adopt this, you'd be okay with everything that comes with that, right? Which is the price controls with the taxes.
I didn't say It's not my preferred policy.
I see.
It's just better. It is objectively better than the policy that you're suggesting.
I see.
Because you still have a consumer interest in getting good quality care at a what is considered to be a fair or good price. Because it's their money up front, and then Singapore puts a safety net for catastrophic care, you handle, the grave disease knowing that you're not going to die penniless, but you have to spend your money first so that for the normal routine things in life, you're
discouraged.
You're valuing it as your
this.
money.
Right.
You're valuing it as your money, not someone else's.
I'll tell you.
Right?
I think we've come together here.
Thing, right? I think you would agree. You're more careful with your money than someone else's. Is that fair?
When it comes to medicine, I never know what to do.
No, I meant in general.
Well, but I'm talking about
medicine.
medicine.
Spending your money than someone else's.
I never
money.
spend other people's money. Nobody gives me that opportunity. But when it comes to medicine, I don't know. I don't know. I mean, when I went in for my colonoscopy, it took me like 3 weeks to figure out like what the heck was going on just with the anesthesia, to be honest with you. So I found it to be horrific. I will say this.
Yeah, there's
I like the idea
that in our health system.
I like the idea. I feel like this is why I think I have a chance to win in the race, because I've gotten you to suggest to me a system that has price controls, that has more aggressive taxation than we have in this country. Also, they have a system.
The taxation is less aggressive.
They have
Singapore
a system.
does not have higher taxation than us.
They have a system of what they call government-run clinics. So it's actually part NHS.
But
so it would be almost a VA for civilians who get really sick.
It's lower than here.
I'm sorry?
It's lower. They spend less. The government in Singapore spends less than our government spends, and they get better outcomes.
They only have 20% of their population uses private hospitals. 80% use subsidized hospitals by the government. All this, I feel like I'm making some headway here. But let's go from single payer Singapore plan. I think maybe if we could get all the things that come with that, it really is. I would be open. I would be open to it.
Well, it would. So here's the real problem with health policy in this country, and this is just real talk. When you try and create a policy that solves 100% of the potential healthcare problems, the policy will be bad. If you create a policy that solves 90 to 95% of the healthcare problems, the policy will be much better. The problem with Obamacare and the ACA was these mandates to make insurance cover all sorts of stuff in all situations, to not allow people who are young and unlikely to need that kind of care to buy different packages, and solving for, the life-threatening rare illness that costs millions of dollars in treatment. When you solve for those edge cases, the overall solution gets worse.
But
if
Nicholas,
you solve for 80 to 90%,
Nicholas,
you can design a solution that works really well for most people.
Nicholas, I have two questions to ask you to assess
Sure.
how much you've thought about that statement.
Okay.
Where does 80% of the cost of our healthcare system come from? What percentage of the population?
I don't know that answer.
You want to take a guess?
I don't want to guess.
I don't blame you because
I feel like that takes longer than you just telling me.
You're not answering, and me talking about this also took longer, but it actually comes from 20% of our patients. So when you talk about trying to aim for 80 to 90% of solutions, you're basically missing the most expensive people. That's the tricky part about healthcare.
Yes.
80% of the costs of healthcare come for 20% of the people. Then let me ask you one more question. How many people were implicated by the Affordable Care Act? Put aside Medicaid. Right? The Medicaid expansion that some states did not do, some that did. But in terms of the actual number of people who were subject to changing their insurance because of the Affordable Care Act, how many?
As I recall, I want to say it was somewhere between 20 and 30 million. Is that right?
A little bit less, but
a little bit less.
Close enough. I mean, it was closer to like 10 million.
Pretty close.
10 million. And and so when we talk about the implications of the Affordable Care Act, really, the only thing that impacted everybody.
That's a bait and switch, though, Sam. That is not fair. Because while that number of people who had to change their insurance is a small number.
No, they didn't have to change it. They did
plans that already existed did not continue to exist, and that affected a much larger pool of Americans.
Well, but that's like complaining. That's like saying, hey, this whole lemon law thing with cars, for instance, that you can't sell bad cars that, you know what a lemon law is, right?
Yeah, for a new vehicle, if you take it for 3 repairs and it isn't successfully repaired, the dealer has to take it back and refund your money.
If there's something fundamentally flawed with the car, it's not really, it's not a sale. Well, that's basically what the ACA did. It said, if you have lifetime caps, if you have yearly caps, if you can be denied claims because of this, if you can be denied insurance because you have some type of pre-existing condition, it's not really health insurance, and so you can't charge for it. It's basically a lemon law.
Well,
it's just that the problem with
if you can't be denied for a pre-existing condition, the thing that you're being sold isn't insurance. Insurance is pooling risk. If you know that somebody has a pre-existing condition, you're not selling them insurance. You're selling them a chronic care plan.
Exactly. And
that's a different thing.
I think you're right about that.
Product.
It's a different product. And I think what we've gotten to is...
But there's no way to make money on that product.
Exactly.
Right?
Exactly. Oh. We have found the fundamental flaw with the existence of the health insurance industry. It is not a real business.
This was built in back in the 50s.
Yes, it was a mistake.
This was built in with wartime price controls that made it tax deductible for your employer to give money to an insurance company on your behalf, but not tax deductible for you to just give money to your doctor. We screwed this whole thing up by government design.
I agree with you. It wasn't just government design that did it. I've done literally numerous interviews with historians on this. But be that as it may.
The wage and price controls?
Yes.
And health insurance as a benefit?
Yes. Be that as it may.
Price controls are government imposed.
The insurance,
are they not?
We have come to the conclusion that the health insurance industry is not a real business. Because if the idea is that we want to make sure that everyone has access, actual access, not a function of their wealth, but actual access to healthcare, everyone, universal, then the health insurance industry is not the way to do this.
No, anything you
buy
is not the way to universality. Universality is giving things out for free.
Exactly.
But free isn't free, Sam. You have to pay for free.
Right. We can tax.
Free actually costs quite a bit.
We can tax. Well, in this instance, we know we have actually libertarian think tanks that have done the numbers, and the difference between the cost of single payer to society versus the cost of the system we have now to society is, according to the Mercatus, is that how you say that? Mercatus Institute, is actually like $2 to $3 trillion less over the course of 10 years.
Well, this goes back to Milton Friedman's paper for Hoover from the early 90s, where he pointed out that both single-payer systems worldwide and completely free market systems like Hong Kong had, both produce better health outcomes at lower cost on a per-patient basis than our mixed system of government-provided health care plans running next to private health insurance plans. That our system is the worst possible system, and yet, we continue to do it because people don't get down to the fundamental distortion that was put in when they put the tax benefits on health insurance, which is it is cheaper for me to give money to my employer, to give money to a health insurance company, to give money to a doctor, than for me to give money directly to a doctor and eliminate those other two people. Right? That's the distortion that makes healthcare so expensive in the United States.
That is one of it. I mean, some of the research has shown that actually it's a function of I don't know if you've ever read that Atul Gawande piece. I think it was in the New Yorker about 10, 15 years ago about
the Checklist Manifesto, or
no, about the two cities in Texas. One of them, I can't remember what they two were, but they showed that even Medicare billing was higher, 20 to 30% higher in one than the other. Same health outcomes, same demographics. Yeah. It was a function of doctors owning their own equipment and basically using it when it wasn't necessary. Now, a single payer system will deal with that because it will look at data across the spectrum of 300 million people being treated and assess what is more effective than others.
That's not correct. Based exactly on the Gawande piece you just mentioned, that is a single payer system, albeit with a smaller market. But if two Medicare cities can bill different amounts of money, there's nothing special about having the government do something that changes any of the human behavioral incentives. So if doctors are going to try and defraud the system, they're going to try and defraud a health insurance company, or they're going to try and defraud Medicare. The government people aren't any smarter or nicer or better trained than the people who work for the health insurance companies in detecting this kind of fraud, right? You have to separate who does something and whether it's government provisioned or there's a market system from the question of how humans behave with each other, which is more fundamental than that. Does that make sense?
I think so.
Okay.
Yeah. But I think, so I feel like we're in somewhat agreement.
You could try and pitch it. I mean, I'll tell you that I think that you do better if you're really trying to seek the nomination with maybe not leading with the places you don't agree with the party on, and maybe going with, the places you do agree with the party on. But,
getting to human frailty, I think that may be a problem psychologically I have, is that I like to lead with that.